Shelley House, family nurse practitioner and a provider for Call on Doc. Let's talk human papillomavirus, or HPV. HPV is the most common sexually transmitted disease worldwide. There's still a lot of confusion about HPV. HPV is a group of more than 200 viruses, and some of them are kind of low risk and they just cause warts, which I know is unsightly and embarrassing. That's the low risk. The high risk ones cause cancers, which is extremely more scary, and it can cause cancer in male and females. HPV can infect genital areas, the throat, and the mouth. Most people don't even know they have HPV because it pretty much has no symptoms, and even without symptoms, it can be transmitted. So how is it transmitted? Well, it is transmitted through intimate skin-to-skin contact. It does not mean that you've had intercourse with someone. So this is where a physical barrier is the best ounce of prevention. Wearing a condom each and every time you have intercourse, or a dental dam each and every time you have oral intercourse, is your best prevention here. Although using a condom or a dental barrier does not provide 100% protection, it does reduce the risk of potentially having exposure to HPV. Now let's talk about how HPV affects men and women. So in men, if they're going to have the cancer version of HPV, it's going to be on their penis, their mouth, or their throat, or in the anal area. For women, like I said earlier, they're going to have cervical cancer, throat or mouth cancer, as well as possibly anal cancer as well. And for women, this is why having pap smear testing done regularly is so vitally important. If you are sexually active, even in a monogamous relationship, we highly recommend that you be tested at least every 6 months to a year. Now, if you're in that high-risk group, we recommend that you be tested every 3 to 6 months. And that high-risk group would be someone that is having casual sex, sex without a condom, or sex with multiple partners. And this leads me to the next chain of prevention. The next chain of prevention is all about communication. I am highly aware that this is an uncomfortable conversation to have with your partner or anyone, because in our society, we generally just don't talk about sex or sexual intercourse. You need to have open, honest communication and conversations with all of your partners about your STD status. With that said, being tested often will help prevent the spread of HPV. Now, let's talk vaccination. Younger people in their 20s may have actually gotten the HPV vaccine between the ages of 10 and 12, for boys or girls. But here's the great news. If you are under the age of 45, you can still get the HPV vaccine even if you have HPV, because it may actually prevent some other viruses that are related to HPV. If you have further questions about HPV, please reach out to Call on Doc how we can help you with the prevention and vaccination or testing for HPV.